Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is Inpatient Prospective Payment System, IPPS.
1. What is the Inpatient Prospective Payment System, IPPS? Let's start with the basics. What exactly is the Inpatient Prospective Payment System, or IPPS? The IPPS is a system used by the Centers for Medicare and Medicaid Services, CMS, to determine how hospitals are reimbursed for inpatient stays. Under IPPS, hospitals are paid a predetermined amount for each patient stay based on the patient's diagnosis and the services provided, rather than the actual cost of care. IPPS was introduced in 1983 to help control rising healthcare costs and to encourage hospitals to deliver more cost-effective care. This system replaced the traditional fee-for-service model, where hospitals were reimbursed for every service provided, which often led to overutilization of services.
2. How IPPS works. Under the IPPS, each inpatient stay is categorized into a specific group known as a diagnosis-related group or DRG. DRGs classify patients based on their diagnoses, procedures, age, gender, and other factors. Each DRG is assigned a payment rate, and hospitals receive a fixed amount for treating patients within each group. 1. Diagnosis-related groups, DRGs. DRGs are at the heart of the IPPS system. CMS assigns each inpatient case to a DRG based on the patient's primary diagnosis, secondary diagnoses, procedures performed, and other demographic factors. For example, a patient admitted for heart surgery will fall into a different DRG than a patient admitted for pneumonia. 2. Weighting of DRGs. Each DRG is assigned a weight that reflects the complexity and resources required to treat the patient. More complex conditions, like major surgeries, have higher weights, resulting in higher reimbursement. On the other hand, simpler cases have lower weights and receive lower payments. 3. Base payment rate. The actual amount a hospital receives for a DRG is calculated using a base payment rate, which is set by CMS annually. This base rate is adjusted for factors such as geographic location, teaching status, and whether the hospital serves a disproportionate number of low-income patients. The base rate is then multiplied by the DRG weight to determine the final payment amount. 4. Outlier payments. In cases where a patient's hospital stay is unusually long or expensive, hospitals may receive outlier payments in addition to the standard DRG payment. These payments are designed to cover cases that require significantly more resources than the average case in the same DRG.
3. Importance of IPPS in healthcare. The Inpatient Prospective Payment System plays a critical role in how hospitals are reimbursed for patient care. Let's explore why IPPS is so important in healthcare. 1. Encouraging cost-efficient care. By providing a fixed payment based on DRGs, IPPS encourages hospitals to manage their resources efficiently. Hospitals are incentivized to avoid unnecessary tests and treatments since they won't be paid more for providing extra services. 2. Controlling healthcare costs. One of the primary goals of IPPS is to control rising healthcare costs. Under the fee-for-service model, hospitals were reimbursed for each service provided, often leading to overutilization. IPPS helps limit costs by standardizing payments based on patient diagnoses rather than individual services. 3. Promoting standardization of care. Because payments are standardized for each DRG, IPPS promotes more consistent care delivery across hospitals. Patients with similar diagnoses are expected to receive comparable care, regardless of which hospital they visit, promoting fairness in reimbursement. 4. Improving care quality. IPPS is designed not only to control costs, but also to improve care quality. Hospitals are incentivized to discharge patients efficiently while maintaining quality care, as longer hospital stays or complications won't necessarily lead to higher payments. This encourages hospitals to focus on delivering high-quality, effective care from the start. 5. Adjusting for hospital characteristics. IPPS also accounts for specific hospital characteristics, such as teaching status or serving a high percentage of low-income patients, through adjustments in the base payment rate. This ensures that hospitals with different challenges are reimbursed appropriately.
4. Challenges and criticisms of IPPS. While the IPPS has many benefits, it's not without its challenges and criticisms. Let's take a look at some of the issues that hospitals and policymakers face under IPPS. 1. Incentive to reduce length of stay. Because hospitals receive a fixed payment regardless of the length of stay, there is a concern that they may discharge patients prematurely to minimize costs. While hospitals are expected to provide appropriate care, the financial incentive to shorten stays could sometimes lead to suboptimal outcomes for patients. 2. DRG limitations. Although DRGs help standardize payments, they don't always account for the full complexity of a patient's condition. In some cases, the DRG system may oversimplify patient diagnoses, leading to insufficient reimbursement for more complex cases or patients with multiple chronic conditions. 3. Financial pressure on hospitals. For some hospitals, especially those serving high-risk or low-income populations, the fixed payments may not fully cover the cost of providing care. Rural hospitals and safety net hospitals, in particular, may struggle to operate under IPPS, leading to closures in some areas. 4. Focus on inpatient care. IPPS applies only to inpatient stays, which may incentivize hospitals to keep certain patients as outpatients or under observation status to avoid DRG payments. This has sparked debate about the best way to manage payments for outpatient and observation care.
5. Recent changes and future of IPPS. The Inpatient Prospective Payment System continues to evolve in response to changes in healthcare policy and patient care trends. Let's discuss some of the recent changes to IPPS and its future direction. 1. Quality-based payment adjustments. CMS has introduced quality-based payment adjustments under IPPS, such as the Hospital Readmissions Reduction Program, HRRP, and the Hospital Acquired Conditions Reduction Program, HACRP. These programs adjust payments based on hospital performance in areas like patient readmissions and hospital-acquired infections. Hospitals with poor performance in these areas may face reduced reimbursements. 2. Value-Based Purchasing (VBP) Program. The Hospital Value-Based Purchasing (VBP) Program is another initiative under IPPS that links hospital payments to the quality of care they provide. Hospitals that deliver high-quality care and achieve good outcomes can receive bonuses, while those with lower performance may see payment reductions. 3. COVID-19 and IPPS adjustments. During the COVID-19 pandemic, CMS made adjustments to the IPPS to provide additional funding to hospitals treating COVID-19 patients. These adjustments included higher DRG weights for COVID-19 diagnoses and increased payments for hospitals facing unprecedented resource demands. 4. Future of IPPS. Looking forward, IPPS is expected to continue evolving toward more value-based care models. Policymakers are exploring ways to further integrate quality metrics and cost control into hospital reimbursement, with a focus on improving patient outcomes and reducing healthcare costs overall.
6. Best practices for hospitals under IPPS. Hospitals can take steps to maximize efficiency and quality under the Inpatient Prospective Payment System. Let's look at some best practices for hospitals operating within the IPPS framework. 1. Optimize case management. Effective case management can help ensure that patients receive appropriate care and are discharged at the right time. Hospitals should focus on coordinating care across departments, streamlining workflows, and identifying patients who may benefit from earlier discharge or post-acute care. 2. Enhance coding accuracy. Accurate documentation and coding are essential for receiving the correct reimbursement under IPPS. Hospitals should provide ongoing training to coders and healthcare providers to ensure that diagnoses and procedures are properly documented, helping to capture the appropriate DRG for each patient. 3. Focus on quality improvement. Participating in quality improvement programs and reducing readmissions or hospital-acquired conditions can help hospitals avoid payment penalties. By focusing on quality metrics, hospitals can improve patient outcomes and protect their financial health. 4. Leverage data analytics. Using data analytics to monitor performance across key areas such as length of stay, readmission rates, and clinical outcomes can help hospitals identify areas for improvement and make informed decisions to optimize care under IPPS.
Conclusion. In conclusion, the Inpatient Prospective Payment System (IPPS) is a fundamental part of how hospitals are reimbursed for inpatient care, promoting cost-efficient care delivery while emphasizing quality and outcomes. Understanding how IPPS works and staying compliant with its requirements is essential for hospitals and healthcare providers.